Welcome to the Bullitt County Health Department's Diabetic Defenders Workshop Series. We are so excited that you've chosen to join us. Diabetes health education is a very important topic here at the Bullitt County Health Department. In Kentucky, over 14% of the adult population is already diagnosed with diabetes. That's twice as high as the population amount in 2000. Kentucky currently ranks 13th in the nation for the adult population with diabetes. Because of these numbers, the Bullitt County Health Department has taken an initiative to help defend our diabetes population here in Bullitt County. We have created this workshop series to help build the skills that you need to take control of your health and take control of your diabetes care management. We want to welcome you to this recorded workshop series hosted here at the Bullitt County Health Department in November of 2024 for Diabetes Awareness Month. Please be sure to listen to all 4 series workshops as they were very helpful and equipped each and every resident that was able to attend with the skills that they needed to take control and become a diabetic defender. Enjoy the series.
I see people on a daily basis, and how I wanted to start this is just to see what do you guys, so you get an hour and a half, and I have some stuff to talk about, but I want to talk about what you all want to talk about. And so when you came to, let me find my little tool here. This is for my memory. What are some questions that you all have that you would love answered today? And I'm going to write them up here just so I can make sure by the end of the class that I have covered.
I'll start. I'm pre-diabetic. I printed off my mod chart and stuff, but I am like trending upward, and it's not going down. It keeps going up and up, and so I'm trying not to, I want that to stop. I want it not to trend up, and see if I can, get it to come down so I don't go into the full diabetes.
So I'm just going to say how to prevent type 2.
Okay.
Is it? Okay.
I have a lot of problems with meals.
Okay. So what to do with the meal planning in general?
Ken is a diabetic, and he's been a diabetic since he was 27, very young, and he controls it fairly well, but we've had a lot of outside things happen. There's a whole lot of problems with his health, and they have put him on Trulicity, and we are having trouble with adjusting to that. He's done really well with it. When he got up this morning, it was like 19. His blood sugar was 19. So we leave that alone.
19?
19.
So,
Did I say it right?
Yeah.
No, 119.
Okay.
119.
Okay, that's better.
So that's good. So we leave that alone. So you have to, the doctor said, adjust the insulin. And one of the things we want to see about, we want to make sure we're doing this right. That we're getting the right amount of insulin, because this morning it was 90. It was 90 this morning. It was 119 yesterday when we took it this afternoon. So that was all day at a very low. But if we go and we get something to eat, up it'll go.
Okay.
And it goes kind of high. And I don't want to have that jump,
Okay. So Trulicity is a GLP-1, so I was going to chit-chat a little bit about that, because that's also a lot of commercials that are out there now.
Yes.
And so what kind of insulins is he on? Is he
He's
on
on
1 or 2?
Novolux 70/30.
Novolux 70/30? Okay.
Yeah, I had a question in there too,
Uh-huh.
because my doctor started me on fast-acting insulin in June, and he just said to do it morning and evening meal. But in between, if I eat anything, it just 300 plus house. And I have a friend and she does some kind of calculating before she eats stuff and she gives herself medicine. I'm like, why didn't you tell me to do that?
Oh. Okay. So I'm gonna put, how does fast acting work? And are you on a long acting at all?
Yes, Toshiba, the one that.
And for my notes, I'm just gonna put breakfast and supper, what can I do about highs in the middle of the day? Does that sound right? Okay, all right. Well, so I'll definitely, some of these things are already, like, I knew the meal planning tips were coming up there, and so I definitely wanted to chit chat about that. Certainly we can talk about this other stuff as well. Can you all see this well enough on there? Okay. So, the one thing, and also you might see me kind of move close, move back, and then, is this recording me?
Yeah.
Okay, sorry, if I
No,
move around too much.
No, you're good.
But trying to keep it informal, so if you got any questions, just let me know. Okay, so, what happens with diabetes is that we say that it is a self-managed disease. And with that, I was gonna do you mind if you hand these out?
No, absolutely.
Just wanted to. And so, yeah, you have the doctor that, the provider that'll potentially prescribe medications, and then we'll ask you to do a lot of things. So things like checking your blood sugar, taking medication, figuring out what to eat, okay? And so it's really dependent a lot on what a person does, though not always, okay? But what I'm getting at is that just to kind of explain, well, what is going on, okay? And I'll kind of take a pause. And I'm Beth, and I'm just want to make sure that I talk about what you all want to learn about today. So when you thought about coming to this class, what were you interested in learning about? Anything come to mind?
We've already gone.
So I've got a list of them.
Maybe like what to count instead of like sugars and stuff. With,
Okay.
like carbs or whatever.
Okay. Anything else come to mind?
Carbs is my main thing that I need to focus on, and I also was in hopes to, I know this is a support group, but also was wanting to meet new people that have the same things that I have,
Okay.
and maybe have walkouts, plan dates and
Yeah.
outings, or just become friends.
And
I know one of my family is struggling like I am, so I need somebody to just be friends with and to see what works for them, and maybe that could be helpful to me.
okay. And so this is going to be really informal, so if other people have anything to contribute, certainly to let that in. And also, you probably realize that this is another series, there's 3 other classes involved in this, okay? All right, so since we're talking about all the things that people need to do when they have diabetes, what I wanted to do is just talk a little bit about what is going on and kind of go from like, well, my numbers are high, what do I look at? So what happens, I always say, I'm not an artist, but I'm loving this whiteboard.
That's pretty awesome.
So, all right. Okay, so when you eat, foods. So basically there are 3 macronutrients that we get calories from. That's carbohydrate, protein, and fat. So as a side note, alcohol has calories, but it's not a nutrient. So we're just talking about carbohydrate, protein, and fat. Carbohydrate is the food that has the biggest effect on your blood sugar. Okay, so we're going to get to, well, how much should I have? Should I have it? You know, what should I do with that? That's coming. Okay, but we're going to see that carbohydrate is going to be in foods that are very healthy for you. So that can be in things like soup beans and quinoa and brown rice and whole wheat flour and fruit and milk. It's also in foods that, like with Thanksgiving coming up, that may not be so great for you. So the cherry pie, the pumpkin pie, the sweet potatoes with all this, you know, marshmallows and syrupy stuff on it, okay? All of that is carbohydrate. And what happens is that when you eat it, it's basically going to go into your belly and your gut, and your body chops it up into little bitty pieces. And the medical term for those little bitty pieces is called glucose, but we're all used to hearing the word sugar. So I kind of use those words interchangeably. Okay? So when I eat, that sugar goes from my gut, and this is the simple version, basically into my bloodstream. Oh, and up goes the sugar in the blood. That's exactly what's supposed to happen. But what also is supposed to happen is that basically your pancreas gets a message that the sugar in the blood is high, and it'll secrete a hormone called insulin. And insulin will go to many of the different cells in the body and basically attach to it and unlock it, and it lets the sugar go into the cell. So when it does that, the sugar in the blood goes lowers, okay, and the cells get the energy they need. And so when there's no issues with blood sugar, basically your body is on autopilot, kind of keeping your numbers in a certain range. But here comes diabetes, okay? And there's some things you can change, like when it comes to risk factors with diabetes, there's things you can change, things you can't change. So you can't change your age, because as we get older, we're more apt or more prone to have diabetes. You can't change if you have a family history of it, because there is a genetic component of it. You can't change race. That's another thing. You can't change if you had gestational diabetes when you are having a baby. Okay? What you can change, which may have an effect, is how much a person weighs, what you eat, if you're active or not. So there's some things you can change, some things you can't. But basically what happens in diabetes, depends on what kind you have, but something happens to where that sugar backs up into the blood, causing a high blood sugar. Okay? And have you all heard of the terms type 1 or type 2 diabetes? Okay. So with type 1 diabetes, what happens, and I don't know which one I should do first. I'm sorry. Is there any way to,
He said page, so let's see.
I think you're just on the second
yes,
page.
two,
Yeah.
two. So if you go
Just
there.
oh, okay.
Yes, so you can add another page.
Oh, okay.
We're learning together.
Okay.
It's okay.
Where was I? Okay. So I'm just going to do this way. So when it comes with type 1 diabetes, basically there's antibodies that your body produces that basically will destroy the cells in the pancreas that make insulin. And so no insulin is being made, and then the blood sugar will definitely go up. It's very life-threatening, and it usually comes on very acute, and sometimes the person will even go into the hospital from it. And it's usually within a very short period of time it needs treatment. Okay? With type 2 diabetes, what happens is that the pancreas is still producing insulin. So it just may not be enough, may not be working quite right when it gets to that cell level. It also could be, what I haven't mentioned yet is that we all have a stored source of sugar in our liver. Okay? And if our blood sugar starts to dip a little bit, we don't have to worry about passing out, because the liver will push out sugar into the bloodstream and have it goes back up again. In type 2 diabetes, that may not be working quite so right, and so the liver is kind of pushing too much sugar into the bloodstream. Okay? There could also be issues with gut hormones that affect it. So there's all kinds of things that are potentially happening that keep that sugar in the blood. Okay? And so, let me see if this, when you think about, sorry my back is towards you. All right, so how is diabetes diagnosed? And I wonder if this will let me come over here. So basically what happens is there's several different ways. And so one of them is that if you haven't had anything to eat, so you're fasting, and your blood sugar is over 126, usually they'll do a second test on a different day to confirm it. But now if I go home and I start getting busy with things like being careful with what I eat and being more active, and I'm basically doing the treatment, you know, what I'm getting at is that with the second blood sugar, when they do it fasting, you shouldn't be doing any therapy for it to see what happens. Now most people, when it's high, they're gonna go home and start doing something, okay? So now I will say with pre-diabetes, what happens is that can be diagnosed when the fasting blood sugar is 100 or more. So that's one way to do it. And then if you have a blood sugar of over 200 at any time of the day with signs and symptoms, so you're thirsty all the time, you're going to the bathroom a lot, you're feeling very, very tired, those are all symptoms of high blood sugar, then that can be enough to diagnose you. But this is the one probably where I see the most, is that the physician will do a test called an A1C. And have any of you guys had that done?
Oh, yeah.
Okay. So what it is, and I might have a little graphic over here. No. Okay. It might be coming up sooner. Let's see. Okay, I apologize about this. I'm trying to get it backwards, but so if the A1C is between 5.7 and 6.4, so the A1C is a number where they can tell what your average blood sugar has been for the past 2 to 3 months, and it comes in a percentage. So if the A1C is between 5.7 and 6.4, then it takes the provider, that's where they may diagnose prediabetes. But once it's 6.5 or more, then they'll usually say, oh, that is a diagnosis of diabetes. And so what happens is that having that A1C done depends, 3 to 6 months. It depends on what the number is, but that might be something that the provider does just to kind of see, you know, what your control is at home. And I think I have a slide here coming up that will kind of tell you what that means. So kind of take a time out on that. But when we look about, okay, what are we wanting numbers to be? So when you go into the doctor's office, what are they looking for? So this is always individualized. Okay, so there's always exceptions when I say this, but for the majority of people, of adults, okay, is that they usually want that A1C under 7, okay? And then is anybody checking their blood sugar at home? Okay, so, you know, your blood sugar fluctuates throughout the day. And so it depends on, okay, well, what time of day am I checking? And so if you happen to be either like when you first wake up, before a meal, and so when I say before a meal, meaning like you haven't snacked, we usually say, oh, for most people, 80 to 130, okay? But when you eat, it goes up. We expect that. So once a person is diagnosed with diabetes, a lot of times we say, oh, it should be below 180. Now we had this question about pre-diabetes, and you know, it's not necessarily a standard of care for people who have prediabetes to check their blood sugar, but sometimes the physician may have you do that. Typically, they're looking for that fasting to be below 100, and then when they're checking, if ever after a meal, below 140 would be a number. Any questions so far?
Well, on the post meal, how long after you eat should you check? To see
About-
if it's that?
So the blanket answer is 2 hours. Okay. Now I'm going to say what happens is that if I have a meal that is a meal with a moderate amount of fat in it. Okay. So what I'm getting at is, let's say I have some vegetables and they may be sauteed in olive oil. And then I have a small side of rice and maybe some fish, okay? That's what I mean by a moderate meal. Then I would have you check 2 hours later, okay? Where it might be different is that if I had like a meal that didn't have,
Like a bowl of beans and cornbread.
well, I'm thinking of like pancakes and syrup,
Okay.
and you know, something that's just all carbs, then there might be, and maybe had juice with it, then it might be a little quicker, where my highest number would be a little bit higher. The other difference, so when it's just mostly all carbs, it can go more quickly, especially when there's not much fat or protein with it. But on the flip side, if I have like fried fish, fried French fries, coleslaw, so I have a really high fat meal, it actually may be delayed. Okay, so it might be like 5 hours later that it's the highest blood sugar. So in how we're encouraging people to eat moderately and to have a variety, 2 hours after a meal.
Should be back down to that 180 at least, or less.
Any other questions? Let's see. So, this is basically just to explain the A1C a little bit more. And so I mentioned it's a lab value over the last 2 to 3 months. And, with it, what happens is a red blood cell has a life of a few months, and glucose will attach to it. And the more glucose it has to it, the higher the A1C. So that's how they can tell. And it's also why you don't have to be fasting to have it done. Now, I will say too, is that it's one set of reference, okay? And what I mean by that is that it's an average blood sugar. So what we're also trying to do is to get people to not have extremes on other sides. So if I have, a 300 blood sugar and a 70 blood sugar, my average is going to be right around 150. And so the average still looks good, but am I having extremes on either side? So, that's why the doctor will potentially, or provider will potentially want you to check your blood sugar at home. There can be a couple of different ways, which we'll talk about. And this is what I wanted to show you. This is my cheat sheet, okay? Because when, I'm talking to you all in terms of, blood sugar being under 180, or, is your blood sugar above 70, that kind of type of number. But when you get an A1C, it's a percentage. And so what happens, and I will say the math isn't perfect, but this is pretty close, is that, when we say, under 7 is the A1C, that's an average blood sugar of about 150. So what happens is that every time you move a percentage point, you're moving 30 points on your estimated, okay? So if I had a 9 A1C, well, the math comes out to be 210, okay? So that's one way to assess your A1C on what your average is. But, let's see, I think what's next. So you know, one of the other things that Jamie asked me to talk about, not that it's needed, but she also asked me to talk about just technology, you know, of what is out there. And you all probably have seen commercials about it. So when I'm talking about checking your blood sugar, and if you have a meter, basically, you know, you're gonna clean off your finger, you stick your finger, you get a drop of blood, you put it on the meter, and 5 seconds later, you have a result. That's kind of like a picture, okay, in time of what is happening. But have you all seen commercials on either a Libre or a Dexcom, to where it's a device that you wear continuously, and you can either hook it up with a receiver or an app on your phone, and it will tell you what the blood sugar is basically every 5 minutes. And, yeah. Oh yeah, okay.
Yeah, I've got one too.
Oh, okay.
We're trying to get it and can't get it.
Okay. So,
I went through it. There's a place for diabetes supplies if you qualify. And that's how I get mine, because I couldn't afford it either.
okay.
It was gonna be over $200 just for those things. But I get it all free.
So, are you comfortable telling me what insurance you have?
United Healthcare.
Is it a Medicare replacement?
And that's part of their secondary insurance. That's what I had too.
Okay.
Yeah.
So,
Medicare and then United Healthcare.
okay.
Walmart told us it's so popular right now they can't get them.
Oh, okay, yeah.
But
Okay.
it's someplace,
You're talking about two different things, honey.
Yeah, that's the insulin, because I
Yeah,
have
we've
to
had
go,
trouble.
There's
We've had trouble with all of
you
them.
can't get
there's a
insulin.
place my husband gets them, and we set it up, it's Edwards
Healthcare.
Healthcare,
Mhm.
and they're very good about.
So, what the deal is, you know, it's never easy, okay? But just to talk about Medicare in general, and then we'll move into CGMS. With checking blood sugar, Medicare will pay, if you're not on insulin, they'll pay for strips, or 80% of your strips, to check your blood sugar 1 time a day. If you're on insulin, Medicare pays 80% for 3 checks a day, okay? But what they'll also do is pay, if you're on insulin once a day for Medicare, and typically Medicare replacements will follow the rule. If you're on insulin once a day, they'll pay for CGMS. So CGMS stands for a continuous glucose monitoring system, and that's like a Freestyle or a Dexcom that are out there.
That's kind of what we're looking at right now, and I can't even get the drugstore to call me back.
Okay, so, okay, what happens, and this is where it gets a little complicated. Medicare requires that you go through a durable medical equipment
Yeah.
company,
Yeah, that's it.
such as Edwards,
Yeah,
okay?
that's what
Now, with that, what happens is that some pharmacies will act as a durable medical equipment company, like Walgreens is one that'll typically do it. Now, not all Walgreens, but some Walgreens will do it. And so, what I would advise to you, so it's typically the provider needs to order it, but they also have to be willing to do, like, they have to do the paperwork for it. So like our physicians will put in the order, or if they know it's Medicare, we actually go through like a portal and we put in their information. So they're gonna want basically a letter of medical necessity from the physician. So even though the prescription's there, they still want a letter of medical necessity. And the other thing that's a requirement is that you have got to go see the doctor for diabetes every 6 months. And then what happens is that the DME is going to ask for those, the chart notes, and we have to send that in. So,
Kim was right too about that. We did have trouble with that, I'm sorry. They told us that they were remodeling them, that's the word she used, remodeling it, and they didn't know when it would be out, and that we couldn't get it, maybe not for a long time.
So that, depending on what you want to do, that could be to where, you can call, a place like Edwards.
Edwards.
Yep, is one. Now, there's a gazillion of them out
Yeah,
there.
but I was-
And what
say
we did,
with
we
mine,
went through there and they set it
my
up with
doctor-
a doctor and everything. Let me get that for you.
My endocrinologist, gave me a paper, and if you don't have it, I can bring it next time, I don't remember. And it listed different places, and she said just to call.
888.
And so I called, and they did all the work. They contacted my doctor,
3434.
got the prescriptions, and they just mail everything. So I don't have to worry about a pharmacy not being out of it. They mail, like 6 months supply at a time. They send me the needles and everything.
On that.
Mhm.
So it is hoops that you kind of have to go through, and you have to work with the doctor's office on that. And just to kind of address is that, like this one down here is called a Libre, and it's actually a Libre 3 Plus. And they, with different, I'm not sure why, but they had the 3, they came out with the 3 Plus, and, they're basically on back order. Some of them are on back order. So, it's just kind of hard to get, The Dexcom is the one at the top, and there's a Dexcom G6 and a Dexcom G7 out. So the G7 obviously is the newest one, but the newer ones have the transmitter and the sensor as one piece. And basically, the sensor is like a little piece of plastic that you insert it yourself underneath the skin, and you wear it, depending on the kind that you have, you wear it from 10 to 15 days. And so it potentially alleviates the checking the blood sugar, okay? And so you can just look at your receiver, or you look at your phone, and you see a number. Let me see if see what my next slide is. Okay, when you see it, it's going to show you a couple of things, okay? Now, you got to go into it recognizing that it's not perfect. Okay, would anybody agree with me on that? And so it's meant to look at trends, okay?
Gives you an idea, though.
Yeah. And so, one thing that you would see is a graph, okay, of what's going on. And so, I don't know for sure, but if the person is wanting to talk to me about their blood sugars, and, it's just about asking questions. So I would say, well, what's happening right around 8 o'clock? And, are they eating, or are they settling down, and they're, just not being very active? So you just kind of look at where it's high and where it's low, and really looking at the lows first, because you always want to stop low blood sugars the first thing, and just start asking questions on what is, what's potentially causing that. But what it would also be is a number, and the number would be, okay, what is my blood sugar now, and an arrow. So the real beauty of CGMS is the trend. So it's going to tell you which way is it going. And so, because like if I was just checking my blood sugar and it was 144, I wouldn't know if it was steady, I wouldn't know if it was going up, I wouldn't know if it was going down. And so that arrow, so of course when it's going straight across is steady, but you can have it going up diagonally, you can have it going up, straight up, double straight up, or the same thing going down. And so it's telling you how quickly is it changing, okay? And that's good information for people to know. Now, the other thing with it is that there is a little bit of a lag time, okay? And so what can be frustrating to people is that they'll want to see and compare it to their blood sugar. So they'll check their blood sugar and they'll see a different number. Okay? And I always say you want to think about a train going up a mountain. Okay? And the first car is the meter. The caboose is the sensor. Right? So it doesn't always work out this way because remember, it's not perfect. But you're going up that mountain and you check both and your blood sugar is going up, your meter is going to most likely read higher than the sensor. Right? You're going down the mountain, the sensor is going to read higher than the meter. Okay? So there is a bit of a lag time and you just got to go into that knowing it.
Yeah, what I do is, if there's not a reason for mine to either spike or either way, so if you say I get a low warning, I check my blood. And, you know, it's not exact, but it's close. Or I can tell if my sensor's going crazy, you know, not doing right or whatever. So that's what I do as a safeguard.
Yes.
If it gets really high, I'm like, well, why is it that high? I didn't eat, you know. And I'll just do a blood check. And
Yep.
Make sure it's in sync.
Perfect. And that's why I say, like, it alleviates a lot of blood sugar checking.
Mhm.
It doesn't get rid of it totally. So, the other thing, I think it's the next picture I got going up here. Oh my, this is busy, okay? But what happens on your receiver or on your phone, depending on which one you got, is that you can see a graph somewhat like this. Okay, so remember when I was talking about a hemoglobin A1C, and I said it's an average. So if I'm 350, you know, my average is still kind of in the middle, and if all I'm looking at is that number, everything's a-okay, you know? But what happens is that, I know it's busy, but look up there with that time and range. And that can be something that if you're using a Libre, you'll be able to see it. If you're using a Dexcom, there's typically, you can see it on the receiver, or there's another app called Clarity that you can download, and it can certainly pull that up. But it's got, like on this example, it's looking at, well, how much red do I have? And we're always trying to get rid of lows. Because, you know, if you're feeling shaky and sweaty and icky and, you know, like driving a car, you know, we're not helping anybody. So we always want to try, make you feel better, get rid of the low blood sugars. Because a lot of times when you're feeling that way, it's really hard as you treat to treat with just enough. And so people usually really have to fight treating until they feel better, which is 15 minutes later, and then they're high, okay? So we try to always prevent the lows. But the other thing is that green, that's time and range. And so that's a little bit of a new term that you might see your provider, like a few years old now, but that they might look at. And again, just how I said that the A1C being under 7 and what your blood sugar goals are individual. This is also individual, but if you start looking a lot on the web or looking at diabetes, you know, journals and so forth, they always kind of say, let's try and get 70%, you know, is kind of what we're looking at. So you can see, compare, well, how's it going? And so that's not an average, that's how much is my blood sugar in that range. And then, you know, what will happen is that it will give like a summary graph. And what this is here, it's the average blood sugar based on the day. And then it's got, well, how high and what's the low for, you know, whatever, this might have been a 2-week time period or something there. And so it'll have that. And so when I look at this, you know, here, I'm not seeing a lot of lows. Now I can go through each individual day too. I don't think I have I put a slide on that. But what I would look at is if I'm not really dealing with a lot of lows, then I would say, what is going on there? And that's probably where I would first troubleshoot. Okay? And so it gives a lot of information. So any questions? So just to give some examples. So this is a sensor. I don't have a Libre on here. And this is another sensor right here.
Guardian.
This is one of the odor sensors. So, and again, what happens is that there's basically something, a serter that you press. It does the work for you. And then at the end of the 10 or 14 day period or 15-day period, you would just peel it off your skin. Okay. Y'all with me?
Mm-hmm.
All right, let's see what's next. Okay, so we talk about, what is the blood sugar, and we keep bringing that up. And the reason why we do is, first of all, for quality of life. So day to day, when the blood sugars are running really high or they're low, then you have symptoms of either, and it affects your life. And so we're trying to ease that up and have a better quality of life. The other thing is that over time, years of high blood sugar, is that it can cause problems in, increased risk for heart attacks and strokes. It can cause, nerve damage in the belly, which can lead to gastroparesis. It can affect the kidneys. It can affect the eyes. It can affect the nerve endings in the hands and feet. So, you hear stories of people who've had foot problems and amputations and so forth. And what we're saying is that what we know with blood sugar control, and then also with looking at controlling that cholesterol, controlling blood pressure, having like good foot care practices, those kinds of things, we can try to prevent some of those things from happening. And so that's when it goes to,
What is that gastroparesis?
So it is where basically the nerve endings in your stomach don't work properly, and it's not moving food through. And so people feel full a lot of the time, and they struggle with certain foods to eat. So, okay, so back to, I'm trying to get that blood sugar in a certain, area, certain range. And so I said diabetes is self-monitored, okay? It's a self-managed disease. So we're gonna talk about, what do I eat? How can I be active? Because that's a therapy. We already talked about blood sugar, checking blood sugar. But what about medications? There's questions to answer on that. Problem solving. Now that might sound kind of silly, okay? But what I'm getting at is that on what I choose to eat, as an example, is, there's a lot to it, okay? And on my choices. And sometimes people need to take a minute to think about problem solving around the idea of what they're eating, to try to make changes. So what I'm getting at, what I tell people is that I know that you solve problems all the time, but how often are you focusing on things that affect your health, okay? So what I'm getting at is like Thanksgiving's coming up, and the other day we have a diabetes prevention program, and we were talking about what people bring to get-togethers, and so we were kind of tackling that, and so we took time to think about what are options and what would be the best thing to do. And so when all these things is that we always say, you gotta try something, and then you gotta evaluate it. And focusing that on things like, how do I improve my activity if needed? Or how do I improve my food choices. You know? So taking time to think about that, that's in there. Reducing risk, so those are things like, you know, having provider visits, getting the lab work done where the provider can assess the labs, taking care of your feet, and all that means we instruct people to inspect their feet daily, and all that means is you take 15 seconds out of your day and you look at the tops and the bottoms of your feet and in between your toes, and sometimes it's putting a mirror on the floor and, you know, with your glasses on or not on, doing this with your foot that doesn't have your socks and shoes on, you're looking at the bottom of your foot. And so, you know, what we're having people look for are things like, you know, winter time's coming, so we get a lot of dry skin. So can I put lotion on my heel? You know, we always say not between your toes because that can be a moist place where fungus can grow. So can I lube up the bottom of my heel to make sure I don't have any cracks there? So we would talk about things with foot care. We talk about smoking cessation, different things with reducing risk. Healthy coping, because stress in itself can make blood sugar go up, you know? So, okay. So we work on all these things, but you know what a lot of people have the most questions about is the what to eat, okay? And so that's where that I have this for you guys, okay? And so I'm gonna have you, it's a fourfold. I'm gonna have you open that up. And I'm gonna go to okay, so I kind of already said, okay, carbohydrate, protein, and fat. Do you remember what has the biggest effect on your blood sugar?
Carbohydrate.
Yeah, okay. So, oh my gosh.
You done broke the board.
Okay, so if you're thinking, give me the easy version, here it is, okay? So you got a plate. Now what I didn't bring with me is a measuring tape. But what happens is that I'm gonna have you, if you want to, go on home and measure your plates, okay? And you're wanting about a 9.5-inch plate, okay? So a lot of plates, like if you just kind of go looking at Walmart or Target, they're like 10 1/4 or 10.5 inches. So you're trying to get more of a smaller plate. Now, a kid's size plate is too small. Now they may have grown since my kids are aged, but basically it's a buffet plate. So have you ever gone to like a type of you know, like a wedding reception and there's a smaller type of plate? It's not too small, but that's basically a buffet plate. It's about a 9.5-inch plate, okay? So in your mind, split it in half, okay? And on one side of the plate, what we're wanting is non-starchy vegetables.
Anything not white.
Well, now, so what do you all think are non-starchy vegetables? Got any ideas?
Broccoli,
Lettuce.
Yep.
Lettuce.
cabbage.
So those are all examples, but thinking of carrots and cauliflower and tomatoes and peppers and squash. And so when you're looking, see how it says know your nutrients and create your plate? All those foods, peppers are another one on there, all of those are non-starchy vegetables. So when you look at this, basically, when you think about, well, they have a very small amount of carbohydrate in them, usually about, as an average, 5 grams of carb per half cup cooked or 1 cup raw. If we would get a little bit further into this, about 25 calories. They're very low in calorie. And then that's as long as I don't put a lot of olive oil or a type of fat seasoning on it that would add fat calories to it. But basically what happens is when you have that as being half your plate, you know, that means you have less of your plate is being, you know, less carbohydrate. So you're using these foods as fillers. Okay? So we are really, really pushing these. Okay? And so that's where kind of back to that problem solving is like, well, I'm not, you know, eating enough vegetables. Well, we can start thinking, how can I fit more vegetables in? So maybe I need to start planning on when I have the vegetables. You know, maybe I need to put more vegetables on my grocery list. You know, maybe I need to come up with some, you know, recipes on roasting or stir frying or whatever to make them taste more where you like them more. But we are pushing those. And we're pushing them because they're low calorie and lower in carbohydrate. And they're packed with vitamins and minerals. So what that does, that leaves half the plate left, right? So we're gonna say, okay, I'm gonna take that in half. Okay? And if you want to, you don't have to, but if you want to, you can have like a deck of cards size of a lean meat. And notice that they have fish as the picture, so we are encouraging fish twice a week. But it also could be something like chicken without the skin, turkey without the skin. If you were going to have beef or pork, we're going to say having it with the words round or loin in it, but grilling. We're just saying trying not to fry on the meats. There is, when you, I don't know if I put a slide in here, I have to think about it, but there is more emphasis on having meatless meals, okay? So beans and cornbread, okay? So as long as we watch what we put to season in the in the beans, and then watching the fat, how much fat and how much sugar, depending on what type of cornbread you like, that I'm doing that could be a meal that we would choose. We just want to make sure that we have that side of the non-starchy vegetables with it.
I understood that the beans are carbs. So.
They are, but they're also a protein source. So it would be considered a meatless meal. So we're gonna in just a minute, we're gonna talk about counting the carbs. So we're getting to that. Were you gonna ask?
Yes, so going along with what you were saying about, you know, having like meatless meals, like what about some of the packaged things that you can get at the grocery, like, I don't know, plant-based chicken patties and that sort of thing? I mean, is that included in that, or is that like
That would be a meatless meal.
So, but I mean, that would be, what would that count as? Like on your plate, what would that?
It would be the protein. Now,
Okay.
backing up a little bit, just like those beans, that sometimes they may have carbohydrate in it as well. Okay, and so on any type of, for diabetes prevention or for diabetes, we're not saying no carbs.
Right.
We're not, well, when I say pointing at myself, the American Diabetes Association is not saying no carbs. So they have a definition for low carb and very low carb, and there's a lot of benefits in those. So we just don't want you to overdo it, okay? And I'm gonna get to carb counting in just a second. Okay. I will say too, I always kind of throw this in, is that we're going to get to it when we get to a label, but we want to make sure too, when you're looking at things that are replacements, that you want to make sure that the type of fat in them is a healthy fat. And I'm going to get to that when I do review label reading. Okay, so I've got a spot left, right? Okay, so this is where your carb, or basically your grain, or your starch would go, okay? And so typically, it's a woman's fist or less, okay? So, the reason why I'm saying that is that I got the old measuring cups out here, and see how close that is. I mean, it's not perfect, okay? but you're really looking at a modest amount, okay? And I will say the emphasis, I just said, fish twice a week if you like it, more meatless meals, all these things about when there's the research behind the different meal plans out there is that what we're trying to do is when you do have the carbohydrate, we're wanting it to be, and I would say foods in general, but more whole, less processed choices, okay? So I am pushing for whole grain. I am pushing for something like quinoa, which tastes a lot like rice, but it has more fiber and protein in it. I am pushing for, in appropriate amounts, but whole wheat pasta, for back to the soup beans, back to oats. We are encouraging those foods, not too much of it, but those are foods that we want. If you're wanting to include some carbohydrate into your meal plan, that's what we would say to try versus white bread or white rice or just regular white pasta. Okay, and then I always say, well, you could have a little side of a fruit over here. Okay, whole, less processed, so we are encouraging fresh. And I'm showing you a little half a cup, so small, a small amount, okay? But it's okay to have fruit. I get a lot of people who are nervous about having fruit because it's sweet and it raises the blood sugar, and the answer is yes, it's carbohydrate. It raises, anything that is carbohydrate raises blood sugar. That doesn't mean we don't want you to have it. It does mean we don't want you to have too much of it, okay? And kind of going back to what I was talking about, more whole, less processed, we would encourage a piece of fruit, fresh fruit, versus canned fruit, though canned fruit has its place, because you can get it in its own juice, and it's portable, it'll stay in the car, it's better than McDonald's fries, so there are benefits to it. Am I making sense when I say that? Because you have it there and it's ready. And then, back to more whole, less processed, even more less processed is juice. And so we would say be really, really, really careful on the juice, because that can make your blood sugar go up pretty quickly. And you only have just a little bit of juice, and it's a whole lot of carbohydrate. Okay. And then I say, most people are drinking water over here. But for that, but you can't, definitely when it comes to milk has carbohydrate, low-fat milk, yogurt, and goodness, there's so many choices of yogurt, but you can find either a plain or with a sugar substitute, particularly Greek yogurt that's very, very low in carbohydrate, and that may potentially satisfy the sweet tooth. Okay, so this is, if I needed a visual, looking right at the middle of your page, okay? But you all, if I flip back to the other page, you all are interested in counting carbs, okay? Some are. Okay, so with that, what happens is that, without doing everybody individual, remember this is just a blanket statement, okay, is that typically 45 to 60 grams a meal is reasonable, okay? Now, where I will say it depends on how much you snack. So if I snack a lot, then I'm probably looking at 30 to 45 grams of carb at a meal. And then I gotta have an amount for those snacks, or if I'm a really tall, muscular individual, that's too low, So it varies, okay, and it's individualized, but for this group, I would say that could be a starting point, okay? So on how you read this, when I'm looking to the right of the wire, it's got my carbohydrate food, and it's got starches, and you look to see, okay, what is the food, and it's got an amount that they're saying is 1 serving. And anything that's a carbohydrate food, again, this is an estimate, it's about 15 grams of carb. Same thing with fruit, same thing with milk, okay? So if I'm saying, do you all want to do 45 or 60 for supper tonight?
60.
Okay, 60 grams. Okay. So what now, without eating out, what are y'all having for dinner tonight? Somebody tell me what they're having.
Celery and water.
I had spaghetti.
Okay, so what I am gonna say, if possible, a whole grain spaghetti. And a lot of people get nervous with that. I will say you do need to cook it a little longer. So anytime you have a whole grain, it typically takes more water, if it's like rice or pasta, and a little, it may require more water and cooking, as well as more cooking time to get al dente in the case of the pasta. Okay, so we're gonna say, because we're trying to do this, is when I see pasta, should be on here. Let me know if y'all see it before
So it'd
me.
be
It's
under
a third of a
grains?
cup.
It's under cereals and grains.
Here we go, pasta. So whole wheat pasta, and so
Do I?
A half a cup.
Whole wheat grains. I
Oh,
was
it's a
thinking.
third cup.
Oh, a third? I think I should put my glasses on.
you gotta hold this pin just right.
I was watching it clicking. I wonder if those little buttons on the side maybe?
That I'm touching something? Or?
Yeah, on the pin, there's a couple of.
Oh.
Okay.
Okay, so if I have a third of a cup, okay, that's one serving, and do you all remember, well, it's every serving is 15 grams, okay? So a third of a cup, so this is 2/3 of a cup, so that's about that much, okay? So I get 60 grams,
That's
y'all
not
okay
very
if we do 2/3 of a cup?
Is that cooked or?
Cooked.
Oh, I'll die.
See, that's not reasonable.
That's not even getting started, is it?
Hang on, okay? So we agree that that's 2 servings, right?
Oh,
And it's more at the top of the page, but anything that's a serving is 15 grams of carb, okay? So if I have 2 servings, 2 times 15 is
30.
30. So far I got 30. Now are you wanting sauce with that or what?
I cook hamburger
Uh-huh,
and then wash it off and drain it and add that to my sauce.
okay.
So I get a protein and whatever else.
You didn't get much of it.
vegetables.
Now, so I'm gonna say, remembering how we're doing heart health, so,
Sorry.
Are you laughing at me over there?
I'm laughing at the.
I gotta know this stuff,
Because I just fixed it.
so we're looking at, do you all understand what I'm saying when I say like 90-10, 90% protein, 10% fat when you're getting ground beef?
Yeah,
So 90 or higher,
Oh.
okay?
even
So-
if you wash it.
Yeah. Okay, so I'm gonna say, okay, and I add, so I'll put some of that in there, and maybe I have, now, I don't think the sauce is in there, and so if it's not in there, let me, there's another app, you're not gonna be able to see it, but I have it on my phone, but it's called Calorie King, it's free, and so, I'm pulling it up, I'm gonna just type in, do you have a favorite flavor of sauce?
Like chunky.
Ragu or something?
Yeah. Mm-hmm.
I don't know if it's good.
Have you ever heard of Calorie King, the app?
Well, that's what I'm on.
Oh, is it?
Mm-hmm. So, okay, so it's not giving me a lot of brand names with that, so meatless, well, we'll add the meat, okay, but meatless spaghetti sauce canned. And I'm gonna say, it's saying about a half a cup as a serving, and I'm going down here about 8.7 grams of carb. I think that's probably one that's got a little lower sugar in it. Some of them are higher than that. So we're gonna say a half a cup. We're gonna say a half a cup of sauce, and I'm gonna count that as like 10. And then I'm gonna add the 90% protein ground beef. So it's really gonna be like a ground sirloin, and that's no carbs. Okay? So write down that 40, okay? So you think about this is that a half a cup of sauce, and here I'm gonna say, like one-third cup. Okay? So you still are having it, and it's not taking up a lot of your plate. So what haven't we included that we want to be fillers?
Salad,
Mushrooms.
Yeah.
just
So
eat
I'm
more,
gonna
eat
say
more pasta.
salad. Do what?
Eat a cup of pasta instead of 2/3.
Well, so we'll get to
And
that.
more
So
sauce.
salad with mushrooms, and I can have carrots and peppers and cabbage, and basically, we're gonna count it as free. Now, I will say, there are some insulin regimens where I would count it, but for the sake of this class, we're saying it's free. All right, so that's the filler, right? Now, remember, I'm a dietitian, okay, so that's just who I am. So I got 40, I get 60. So there's a food group that I haven't added yet, and that's fruit. All right?
Tomatoes.
Do what?
Tomatoes? Is
Oh,
that,
yeah, that would be with this.
I thought tomatoes were fruit.
Well, so when you think about, and this is where I don't know if I'm gonna be able to answer it. So technically with the seeds and so forth, they are,
Mm-hmm.
but carbohydrate wise, they match green beans.
Okay.
So for diabetes, we count it as a free food. Okay, so could I have, so it's, you think about this time of year, you think pears are coming in season, right?
Apples.
Apples, so I could have one small apple. And so that's 15, so I'm at 55.
Your salad dressing.
Yep, so salad dressing, so on that one, I would say like an oil based, but I'm gonna say on this one, I love this one, it really doesn't, unless I got like honey mustard, doesn't really have a lot of carbohydrate in it. If it's regular, it can have a lot of calories in it. So a lot of times I say, okay, put it on the side, if this is your fork, up and down, and then in the salad and eating it that way, And then I can say, oh, I'm gonna have a tablespoon of Parmesan. I never spell this right. I don't know if that's an E or an A. Cheese, and I'm gonna say that's free too. Not gonna worry about that. So it's a much different way for some people of eating. Okay? And I will say, if you're going back for more, this is the first thing you go back. Yes, ma'am.
The whole wheat, on here, it doesn't say whole wheat.
Yeah, it's just saying pasta.
I
So
can
it's
still have my
white.
other pasta.
But the intent of the carbohydrate is to have more whole wheat.
Tried to get over to that. I tried it, but it was like 10 years ago, and it was awful stuff.
Well, remember, cook it long enough. Like
It was
on
mushy,
regular
though. That's-
spaghetti,
it
you
just
took
turned
it too
to
hard.
mush.
Oh.
Maybe they've improved it, now. It was new
Mm.
back when I tried it.
What about those zoodles, the little skinny
Yeah,
noodles?
so when you have stuff like that, it's So I'm gonna go back a little bit. So zoodles are, my impression of them is that they are basically twirly zucchini or
Right.
squash, okay? Those are non-starchy vegetables. I'm only cautioning when, like sometimes I might go to the grocery store and there's like a vegetable pasta. That doesn't mean it doesn't have carbohydrate in it. It might have some spinach added to it and that makes it green, but that doesn't mean it still doesn't have wheat.
How about adding some garlic bread?
Well, okay, so now it's like you're on a budget, okay? And so if I want that garlic bread, I gotta give up something that's got carbohydrate, okay? And yeah, you can do it. Now, this isn't meeting the intent of, like when we talk about meal plans, like a Mediterranean meal plan or something called a DASH. You know, we're really wanting a lot of vegetables and fruit, but I could and have, you know, now here I am, a whole wheat, you know, small whole wheat roll. You know, I can add that with it. So the Texas toast, though, you know, is going to be more than 15 grams of carb. And it's going to have a butter on it, you know?
A garlic breadstick at Fazoli's is 16 carbs. Ugh.
And they keep coming around with more.
So just to clarify, you were saying that 45 to 65 grams per meal, right? For,
As an estimate,
okay.
as an average.
So that's like that's 3 meals a day.
Mhm.
And if you snack, so basically, just so we split the difference, we say 50, so like 150 grams a day.
Mhm.
So period. So if you're snacking during the day, then you've got to adjust that at your mealtime.
So I need to get out my calculator. So this is where, again, I would individualize it.
Right.
But what the American Diabetes Association is saying is that if it's under 45% of calories, it's a low carb diet. If it's under 25%, it's a very low carb. So what you got to know is, well, how many calories should I be having?
Mm-hmm.
And that is based on, you know, my goals for my weight. So, in who I see at the office, I'm going to say 9 out of 10 people are interested in weight loss. And so, again, as a general rule, I would say that for women, it's usually 12 to 1,500 calories per day. For men, 1,500 to 1,800. So the common denominator in there, well, the common number is 1,500. So I'm using that as an example, okay? So if I do 1,500 calories, and I'm saying, oh, no more than 45% coming from carbs, that's 168 grams of carb. So that is a low carb diet. If a person wanted to do a very low carb diet, based on what the American Diabetes Association said in their consensus report, is that would be like 93 grams of carb a day. So it's 150 is very moderate.
Right. So, and then, so the non-starchy vegetables, we don't have to count those. They don't count in as part of it, as part of what we count.
So I'm gonna say, technically, they have a little bit of carbs, but in the population that I see, it's really people who are dosing insulin with how many carbs that they're having that I would have them counted. So typically I say no, but I reserve the right to tell you differently.
So we should also, like counting carbs and everything, we should count calories.
Well, so carbohydrate is to control your blood sugar. Calories is to control your weight. So what I'm getting at is that this, not many carbs, this, not many carbs, where's the other one? This, not many carbs. So I'll get people who, and I'm not saying that this is bad, they'll take foods that don't have many carbs, so they'll eat a lot of avocado, or they eat a lot of nuts. So very healthy foods, but they're very caloric foods. Now, there's also caloric foods that aren't very healthy, like pork rinds and bacon and things like that, butter. But it's, that all adds up to calories, and whenever a person, I'm oversimplifying this, but whenever a person eats more than what they need, then they're apt to gain weight.
Because since I've been here to take the insulin and stuff, my weight has just, I put on like in a year like 30 pounds.
And so insulin is an anabolic
Because
hormone.
I'm trying to keep this right and keep from going low.
Yeah, so if you're having to eat so you don't go low, you're on too much insulin. You know? So the purpose of counting carbs is that, and I'm just making up an example. I think I just touched something. I'm just making up an example. So say and you're like what you mentioned is that you're on it twice, you're on fast acting twice a day. So I picked 60. So for every breakfast, the goal is 60. And so with the provider is gonna see, well, how much insulin are you taking? And if you're being consistent in your amount of carbohydrate and you're going low, they're gonna say, oh, I can back you down. If they're going high, you're gonna say, oh, you need more. And so then do the same thing for supper, you know? But if you're saying that you're having something at lunch and you're high by supper, then what can you do? Well, without taking additional insulin, you can have, that could be where you have a salad. You have something that's low carbohydrate. And so, or maybe I have one of those Greek light yogurts, you know, something that, again, that is low carbs, or you could have, that's where a salad and I put some salmon on it, you know, or have tuna on that. And see, does that make it better, you know, for my supper without taking anything at all? Or can I go, now this is, if you're really high, you gotta be careful with this, but if I'm, you know, can I go walk around the block a couple of times, and does that make the blood sugar go down?
Does it?
Well, exercise does, but if
At the
what I
moment?
would say, if you're high, really high, and you know, if you're dehydrated from being high and you've been high a lot, probably not a good idea. But if you're high just because from what you ate, one meal, yeah, go for a couple, you know, go for a walk, and that should bring it down.
So you talked about adjusting the lunch. Is that something, I know obviously we're problem solving and, you know, kind of obviously goes into that, but is that something you would need to experiment with for multiple days in a row to see if it was working, or should that be noticeable in one day?
Well, it depends on how high going into lunch, but if it could be noticeable in one day, for sure.
But if you were going to adjust your diet at lunchtime, would you recommend trying a different lunch menu for a few days to see how it goes, or?
Well, the first thing I would really do is well, and I'm not saying you're doing this too, but I'm just thinking about people that I see, is that sometimes could I just go back to it being moderate in carbohydrates? So, you know, if I'm talking to them and they're taking in a regular soft drink, that's another 45 grams. So let's just do it without the soft drink and see what happens, you know? And so, you know, I think that is fair, because having no carbohydrate at all is rough, you know, to do that. And so it's fine to do just a very modest amount and see what you get. If it's still running high, you could do the modest amount and go for the walk. Still running high, you could go no carbs and see what it does. Those are all options. But it could be to where you see a difference that day.
Sorry, I have another question. So, what about artificial sweeteners? So I've heard stories from different camps, like, oh yeah, it's fine to use artificial sweeteners, and then I've heard other people say, well, your body still thinks it's sugar coming in, and it still has an insulin response if you're drinking like a Diet Coke, as opposed to regular Coke. So what are your thoughts on that? Because so many products, like yogurts, you know, will say 0 sugar, but then when you start reading, it's got like an artificial sweetener in it.
Well, so what I'm going to say, it's not really it's more like, what does the American Diabetes Association say? Okay. And so, you know, what happens, and I will say, you know, standards of care gets updated every year, so it might change. So people say, well, is it good for you? I'm not gonna say it's good for you at all.
Right.
There's no information there. What the American Diabetes Association says, water is best,
Right.
okay? But then they have this clause in it, and they say, well, if you're gonna have it, have it in moderation, and don't have it, like, as an example, don't pick a Diet Coke so then you can eat apple pie, so
Right.
so right now, they're not restricting it more than just, have it in moderation. There is literature out that, does it change, they're wondering, does it change the gut microbiome? And does that change things? And so there's some things we just don't know. So the rule, short term is that I'm not gonna say maybe benefits, I'm not gonna say that, but it's not a blanket no. But are we wanting people to continuously choose it? We're not saying that either.
Okay. And that just, you don't count that as anything? I mean,
Well, so it
did you count
depends
that?
on what you're, like a soft drink, no. A diet soft drink, no, that wouldn't count. But if I have a sugar substitute in a dessert, well, like an apple pie, well, there's apples, there's pretzels,
Right,
there's other
right.
things that have carbohydrate.
Okay, like yogurt,
Would have
would have,
carbohydrate. Now, what happens is when you get the Greek yogurt, it's higher in protein and it's less carbs in it in general.
okay.
Even in those little cups,
Uh-huh.
because they still show a lot of sugar. Or
Well-
it's like you had to get that, like, nothing.
Like Oikos or
Yeah,
the
nothing
000
at all.
one. Can I keep going? Have I exhausted you all? 'Cause
No,
I
keep
wanted to
going.
do what?
Keep going.
Okay, because there's a label in here somewhere. There we go. Oh, okay. So that's just to remind me, I'm gonna have you guys, let's go to the back side of page 4, okay? So you're gonna see it's got the serving size there, and that's where you gotta know, well, how much am I eating? And back to this, again, it's great to measure. We use back to the fist is a cup, a woman's fist. Because I always, I'm making a fist for me. So notice the difference, okay? So, and then another, now it's not exact, but a lot of times a woman's thumb is a tablespoon. A thumb tip is a teaspoon. A deck of cards or just a woman's palm could be about 3 ounces of meat. And I think that's above the label, okay? So measure if you can. You can't always measure, and so it's okay to estimate. But you're coming down here, and you would do a couple things. So when you go to the line that says total carbohydrate, how many grams do you see?
34.
Oh, 30. Oh. Okay, so maybe there's 2 different versions. So I got
Which one are you
37.
looking at?
Oh. Oh,
I got the
oh.
wrong one. Sorry.
Oh, that's okay.
Hey, it was a label.
Yes, it was. So 37 grams, or you're looking at the right thing, and that's per serving, okay? So if I decided 2/3 of a cup wasn't enough and I added more, I gotta add on to the carbohydrate. Same way if it's lower. I needed to tell you that fiber, sugars, and added sugars are part of total carbohydrate, okay? And when we look at what we're trying to do with added sugars, we're trying to keep them as low as possible, okay? And so this is your honey, your agave, your table sugar, your high fructose corn syrup. Some is added into food naturally, just like shelf stability and to color, that kind of thing. It depends. Jamie, I'm not sure which medical organization you look at. So one is more liberal or conservative, and one's more conservative than the other. I usually say 10 to 20 a day, 10 to 20 grams. Okay. So a regular soft drink, 12 ounces is like 45. Okay. So that's one thing to look at. The other thing that I always want people to look at is that we want that saturated fat, so it's the one underneath total fat, to really be as low as it can be, okay? The lower the better. And this is anything that is fat that is animal-based or palm oil or coconut oil. The other thing that I look at is I try to get sodium, and you know, I am going to have you go over a little bit and look at the percentage on that one. So what do y'all see as a percentage?
7.
7, okay?
7.
So if you got something under 5, you got a green light, okay? If you got something 6 to 19, you got a yellow light. So it doesn't mean no, okay? And if you got something that's over 20, it's a red light, okay? Now what I'll say is that these are for single ticket items. So if I'm getting a healthy choice dinner, you know, and it's 23%, I'm just making it up, but it's probably in the 20s. You know, I'm not gonna fuss so much about that because it's better than going out to eat, you know, and getting soda in that way. And plus it's got a lot of, it's a meal, okay? It's not a single ticket item, it's a meal that if you add a salad to it or a piece of fresh fruit, you're still adding things that are very low in sodium.
Could you say those numbers again? I'm sorry.
And
Green light?
5 or under, green light, 6 to 19, yellow, 20 or more, red with an asterisk.
Okay, thank you.
What about sugar alcohols? You see that on a whole lot of things.
Yeah, so sugar alcohols, it could be in something like ice cream or chocolate candy, sugar-free chocolate candy. It could be in pies that are sugar-free. And I always say be careful because sugar alcohols are not necessarily absorbed, and so they can cause like bloating and diarrhea and cramping. So they can hurt. Now, some people tolerate them just fine, okay? But it can raise blood sugar, and so I would still have you look at total carbohydrate. Okay, I'm sorry. I already went through that. Woohoo! Okay, I got one more thing to say because I gotta come back to, I love this thing. All right, so, I'm coming back here on how to prevent type 2 diabetes. So what they found is that if a person needed to, a modest weight loss, 7% weight loss, and 150 minutes of physical activity a week, okay? And I will say too that 150 minutes is still with people with diabetes as well. So that's like walking, if a person liked it would be fine. It doesn't have to be. It could be to where they do, you know, sitting in a chair and they just do, you know, any type of chair exercises, anything to get them to have some labored breathing, okay? And if I kept doing this, you would start to, for me, you know, hear me kind of, not gasp, that's not the right word, but be a little winded. And so when we're talking about that aerobic activity, what you're trying to do is have winded breathing, be able to talk still, but not sing. So if you can sing, you speed it up, okay, or get a little hill in there or something, okay, get some resistance in there. Okay? And that's a different definition for different people. Okay, so again, I'm flying through this. All right, so I wanted to kind of like, I think I talked about that one. Okay, talked about that one. All right, this one. Okay, so back to GLP-1s. So this is the Trulicity, or have you seen the Ozempic dance, or you know, on the TV commercials about they're a type of in one dose diabetes medicine that can help the blood sugar, help a person lose weight by making them feel full, and then with a larger dose is FDA approved for weight loss. Okay, and so what happens is that they help you feel full. And so there are some nutrition considerations that we would talk about. So this might be a time where we would say we do want you to have snacks because people are feeling so full when they take this drug is that they need to eat small, we call them eating events, but small eating times, but often throughout the day. So that would be a time when I would encourage snacks. The other thing is that they gotta get enough fluid in, okay? So one article I read, 2 to 3 liters, so that's 8 to 12 cups of fluid a day. So you need to stay well hydrated on that. You want to make sure, it slows your gut down. So you want to make sure that you're getting in the fiber. And so we're pushing back to getting the whole, less processed foods like vegetables and whole fruits. I would kind of mention is that, for some of them, they're typically once a week. And for some, especially on the lower doses, it might, your hunger may come back at day 4 or day 5. And so you might want to position the day that you take the injection to be around the time where you struggle with eating habits that are more challenging for your weight. Does that make sense? So
Like
if I
weekend.
Nighttime.
yeah, well, if I struggle on weekends, maybe I take it on a Thursday where it's covering me more then. The other thing I see a lot is that people aren't eating much, and so we want to make sure that they get enough protein in. So, I usually talk to them about a minimum number of protein because they'll do a lot of skipping. Okay, so this is just a little blurb about pumps because we were talking about technology. I know it's 7:30 or no 6:30. I'm going to let you all go if you want to. If you wanted to discuss this, we sure can. The only thing I didn't talk about here is just Novolog the 70/30, and what I would say on that, not always, but it's usually twice a day. And it's usually before breakfast and before supper, unless your provider told you differently. It's got 2 different types of insulin in there. And so this is a type, people are typically on set doses, so we would have you have that set amount of carbohydrate, such as 60 grams 3 times a day. Some people may include a little nighttime snack in there because part of it works more actively through the night when they take it at supper.
But you should take it every day, along with the,
Well, so this is based on, typically, so it's really what your provider says.
he said adjusting.
Oh, okay, so,
But I'm wondering what adjust is,
so I'm gonna say, I can only tell you what we do at our office, and so it would be talking to that. And so if a person is having a pattern of low blood sugars, our physicians would decrease by 20%. If they're having a pattern of high blood sugars, they would increase by 10%. So,
maybe switch the heavier dose tonight and the lighter one to morning.
well, I feel very uncomfortable telling you. I mean, I would have to say getting more instruction from your provider on that. Because that could be a big difference there. Okay, alrighty, so next week, it is, or Thursday,
Yeah, it's this Thursday.
okay, oh, it's the search, okay, healthy eyes. So.
Thank you so much for watching this episode of the Diabetic Defenders, Building Your Defense Against Diabetes. We hope you'll join us for the rest of the series as well. Click subscribe on the Facebook page or Instagram and YouTube, as well as Twitter. We look forward to seeing you next time. Bye.